There are over 200 types of HPV. Some are harmless, while others are high-risk strains that can lead to cancer. I'm Dr. Anna Wilkinson. I'm a family doctor and GP oncologist at the Ottawa Hospital. Today, I'm answering 5 of the most Googled questions about HPV. HPV is a very common virus, the human papillomavirus. It's thought that about 80% of our population have had an HPV infection at some point in their lives. The HPV virus typically doesn't cause any problems, but we know there are a subset of HPV viruses which are oncogenic or cancer-causing. These HPV viruses that cause cancer can cause cervical, vaginal, vulvar, anal, and penile cancers, as well as head and neck cancers. Now let's dive into the most 5 Googled questions about HPV. Question number 1, how do I know if I have HPV? The HPV virus doesn't really cause any signs or symptoms, so you would never really know if you actually had HPV or not. That being said, it's super common and it's passed through skin-to-skin contact, so the majority or 80% of the population have had HPV at some point in their lives. Question number 2, is there a cure for HPV? It's not something that you treat with antibiotics or medications to make go away. What happens is the body's immune system naturally clears HPV for most people. So the majority of people have a short-lived HPV infection that really causes no problems. There's just a small subset of people for whom HPV remains persistent, and these are often the people who are at risk for developing cancers. Question number 3, will I get cancer if I have HPV? The majority of people who have HPV never have any problems and never know that they had the virus in the first place. In a small subset of people, the HPV infection remains, and if you have the specific cancer-causing subtypes of HPV, those are the people who are at risk for ultimately developing cancers. That's why we have HPV vaccinations, so that you don't get HPV in the first place. And that's why we have cervical screening programs, where we look for early changes that suggest that you might have a cancer-causing HPV strain, and we manage and deal with those changes to prevent you from ever getting cancer. Question number 4, does HPV ever go away? The vast majority of the population clear their HPV infection within 2 to 3 years. That's why with cervical screening, we screen every 5 years with HPV screening, because we really only want to find those infections that are going to persist and cause problems. We also really only want to find those infections that are the cancer-causing subtypes, because those are the ones that are high risk that we need to manage. Question number 5. How do I protect myself against HPV? The best way to protect yourself against HPV is to get the HPV vaccine so that you never get infected with it in the first place. The HPV vaccine is given in grade 7. So if you have kids, make sure they're getting their vaccine in school. And if you miss the vaccine yourself, you can see your primary care provider to get the vaccine at any time. HPV is common, but high-risk types can lead to cancer. Cervical screening now uses an HPV test to detect the strains that cause cancer, allowing us to catch risk earlier than before, making screening more important than ever. If you're due for screening or need a vaccine, book an appointment with your healthcare provider. Thanks for watching.